Dr. Digles, we just had our first trivia question. So will this decompression therapy hurt at all?
Well, the short answer to that is no.
Great.
It's almost embarrassingly so, because when the patients are on it, some of them fall asleep. Some of them ask me to turn the machine on when it's already been on. So the whole key is to apply force to the spine to create a distractive force on the vertebrae,
right,
but that the patient is relaxed so that can happen.
Excellent.
So it's a very gentle therapy. I have patients watching movies, we have a video monitor, and we're listening to music or reading magazines, so
great.
It's virtually painless.
All right, let's take a look at a video of a patient actually getting on the decompression therapy table.
Okay.
And we'll talk about that.
Okay. The doctor's instructing the patient to lay down. I think he's pointing out there's also an infrared heating element that's underneath the table that causes a further relaxation of the spine.
Nice.
The patient's laying down, and if you can see that thing he's touching there, that's a gelled brace, and he's going to get another one out.
Okay.
And then what that's going to do is capture the pelvis. That's going to stabilize the pelvis, and he'll hook that up.
But that's not really tight or anything like that?
No, it's not tight. It's snug.
Okay.
You know, it's probably like somebody can put their hands on your hips and press in.
Okay.
That's about how it feels. Very comfortable.
Great.
Again, if it was irritating, it would cause muscle spasm somewhere, and you'd be defeating a lot of the purpose of the whole treatment. So
right.
Keeping the patient relaxed. Now he's bracing the upper torso with a nylon belt, and then a knee block will come up and hold the knees up, and that's very relaxing for the muscles that raise the femurs.
Great.
And a pillow behind the head, and you can't see the video monitor right there, but he can swing that video monitor forward and the patient can watch a movie. So he's just putting a safety switch in the patient's hands if there's any discomfort, and you know, if for any reason you can press that button and the treatment stops automatically.
Okay. And how long is the average treatment?
30 minutes.
30 minutes,
yeah.
Okay.
And there might be some things to do before the treatment and a little bit afterwards. So.
Okay. So, Dr. Digles, are the results lasting?
Definitely, because we're causing a healing effect. We're creating the environment so the disc can actually heal, so we're not patching or cutting something out, so you have a great potential to have long-lasting results.
Okay, so if I start decompression therapy, am I able to return to work?
Yes. Only cases would be if professional athletes are heavy lifting and twisting. You'll maybe have to have some work restriction, but
okay.
Yes. Yeah.
So if decompression therapy is so great and it's working for people, why aren't doctors recommending it, and why are they still performing back surgeries?
Well, many doctors are recommending it, and the research is starting to pile up, so it's just only going to increase. Knowledge travels slowly sometimes, but...
Now, there are different decompression tables out there in the market, but what makes Spine Med that much different?
Well, the way the forces are applied to the spine, with the pelvic harnessing method and the computerization of the cyclical forces, it takes about 40% less tension on the spine.
Okay.
So it's a lot more comfortable and a lot quicker, a lot more efficient, so you can precisely target different disc spaces as well. So.
Now, once I start decompression therapy, why is it important for me to come for 20 or 30 visits?
The typical treatment is 20 visits, and that's because we not only get rid of pain by decreasing the pressure, getting pressure off nerves, and creating that environment to do that, but we want to create the healing effect in the tissues, and that just takes time. Okay. And with the decompression forces, that stimulates the healing effect.
All right. Now, this is really important, just in case someone's tuning in right now.
Okay.
Can you explain for us again on the spine model how decompression therapy works to eliminate pain?
Great. The patient's placed on a table, and with, again, the computerization and the sophistication of the cyclic forces, a distraction force is put into the spine, very gently, very targeted, creates a negative pressure in the disc space, causes that disc material to then restore back into its normal position. And that takes pressure off nerves, takes a healing effect of those tissues as well. So.
Okay, great. Time for another break here, but as we do that, we'll take a look at some patient testimonials. Great.
Before my treatments on the Spine Med table, I could not sleep, I could not stand, I could not walk, I was in such pain. I had a lot of numbness in my legs. I could not do the things that I love to do. I love to cook, I love to care for my house and my family and my animals. And since my treatments on the Spine Med table, I can do everything that I could do before. I can get in the kitchen and cook my fried chicken and make all my homemade candies and cookies and things that I enjoy doing for my family and my friends. I can get out and take a walk. I can clean my house. I can use the vacuum cleaner. It's just such a wonderful thing to be me again.
My name is Willie Hawley, and I work in my shop now. Before, I couldn't do anything. The pain was so great. Now I can move my saw around. I can lift my plywood. I can do just about anything I want in there now. Since I've been on the decompression table, I've been able to do all this. I can build things. I can do just about what I want. And before I couldn't walk. Now I'm walking 2 miles at least 3 times a day. I recommend it. If you have back pain, go to the decompression table.
I am a scroll sawer, and I love working with different kinds of woods. I make picture frames and baskets, and I sit for, many hours. My back has been doing a lot better. I can actually sit there and enjoy doing it. Plus, I really enjoy cutting grass. I'm doing really well right now. I haven't had any pain medication at all for, it's been about 6 months now.
If you're suffering with recurring back pain, neck pain, or shoulder pain, leg pain, or disc degeneration, and are looking for a natural way to correct it without using medications or surgery, then you need to call the number at the bottom of the screen now and make an appointment to see if you might be a candidate for the SpineMed decompression therapy. When we come back from our break, we're going to continue to talk about why SpineMed decompression therapy is fast becoming the most popular non-drug and non-surgical treatment for treating recurring back pain, neck pain or shoulder pain, leg pain, and disc degeneration in the country. We'll be right back.
Welcome back to Phenomenal.
Welcome back. I'm interviewing a doctor about spinal decompression therapy and discussing why it's becoming the most popular non-drug and non-surgical treatment for recurring back pain, neck pain, leg or arm pain, and disc degeneration in the country. Let's hear the last part of the interview right now. Doctor, does SpineMed decompression therapy have a better success rate than back surgery?
Well, back surgery for herniated disc has less than 50% success rate.
Wow.
Clinical studies with decompression that have been done several years ago showed an 86% success rate. Now, the doctors that I talk with around the country, with some tweaking, some other things they do physical therapy-wise, their success rates are into the 90%. So, phenomenal success rate with this therapy. Yes, it is.
So, what's your favorite new thing about this treatment?
Favorite thing?
Yeah.
Would have to be the results.
Yeah.
You change people's lives. I have a patient of mine who, professional golf instructor, could not golf because of leg pain. Tried to set up putting, couldn't stand. Instructs people all day long.
Really?
Got him on the decompression table 3 times. He golfed in a tournament last weekend. No pain. That changed his life. And you say, well, you might not feel sorry for somebody who's a golf pro.
Right.
But wife, 4 children, that's how he makes his living.
Yeah.
On the flip side of that, I got a gal, failed back surgery of 3 years ago. Waiting tables, her and her husband, just getting by. Two kids starting out in life, but can't do the waiting tables because it's quick money for her and something she can do. Almost had to quit her job. Couldn't stand the pain after 6 hours on her feet. Decompression therapy, one time, she comes back in my office and asks me, and I ask her, how'd you do after your treatment? She said, I don't want to talk about it. I don't want to jinx myself.
Right.
She felt so good. She's going through the protocol right now. So it changed lives.
That's incredible.
Numerous stories like that.
Yeah. So if someone has had back surgery, let's say, can they still go ahead and have decompression therapy?
Yes and no. If there were not rods or metal parts put into the spine, yes, they can have compression therapy. Even if they had a fusion, if the fusion's healed, at least over a year. But failed back surgery is not a problem to deal with in most cases. But it's best to come in for an exam just to make sure everything's okay.